In fact, x-rays are very late stage diagnosis. Decay has to be at least 2 millimeters into the second layer of tooth under the enamel before an x-ray can begin to catch it. So let me give you a little...
In some ways, like in cancer diagnosis too.
Yes.
Frequently, x-rays are used to screen for breast cancers, but by the time they find it, it's already considerably advanced. It's certainly not a physiological screen, it's an anatomical screen.
Yes, and then you have to be much more invasive in treating it. And so you want to be able to catch diagnosis early. The more tooth structure you leave, the more it's able to shake, rattle, and roll as you chew, the more it's able to function for a lifetime. In fact, if you have to cut more than, a tooth in function without a filling can take about 500 pounds of pressure, which is about how hard we chew. If you have to put a filling in that's about 1/4 of the width of a tooth, that goes down to its ability to withstand that pressure of about 313 pounds. And then if it's, say 1/3 of the width of the tooth, that goes down to its ability to withstand pressure of about 213 psi, I believe, something like that.
Then what happens if you actually replace it with the crown, because it's, you've had the fillings, multiple fillings, and then enough of the structure is destroyed where you have to repair it with the crown. Does the structure of the replacement crown that you put on top of the tooth, does that replicate the initial 500 pounds of force?
Oh, it can handle force, but it concentrates it all in one place. So let's go back. You mentioned something kind of interesting that we should understand. When I wish we would change the vocabulary in dentistry. I'd like to get rid of the word drill, for the most part, and fill, because neither of those really have a place in dentistry, if that's a little shocking thought. But dentists don't need to use drills as much as they do. Drills tend to fracture a tooth apart. They're a straight line way of amputating the tooth. They remove far more tooth structure than is necessary. They don't leave a very clean design, and they kind of propagate cracks throughout the tooth. And it's like a windshield. You don't know which cracks are going to propagate and which ones aren't. And traditional filling designs are usually very boxy looking. They're going to be larger at the bottom than the top, and they're always going to end with a little point. And unless you know how to rebuild a tooth correctly to structurally put in the stress distribution pathways, you're not going to be able to do that, and the tooth will break down and need repair, break down and need repair. It's said that probably 70 to 80% of what a dentist does is to redo old fillings that have been done.
But I think